Good morning, everyone. So I'm Dr. Aggarwal. I work as a psychiatrist at MU Healthcare. So I'm going to talk about the psychotic symptoms in Parkinson's disease. So you've already heard about, that Parkinson's disease can have motor symptoms and non-motor symptoms. So as Dr. Siddiqui mentioned, motor symptoms are something that everyone can see readily, and that's the more focus, but non-motor symptoms are as important as well. So Dr. Brand just mentioned about depression and the treatment, and later on you're going to hear about the GI issues with the constipation, sexual dysfunction, but for this topic we are going to focus on the psychosis. So most of you might know, but I thought it would be a good idea to give you a general overview of what different term means. Some people say, psychosis, I don't know what it means. So in general, psychosis can be defined or means as it's an altered thinking. So the way you think, it's altered. And also you cannot distinguish what's real and what's unreal. So what's there, if you're seeing something or hearing something, if it's in actuality there. So that's the broader term of psychosis. Hallucination is a big part, and what hallucinations means, it's a false perception. So there's nothing out there, but you can either see it, hear it, feel it, or perceive it, but there's nothing out there in reality. So a related term is, it's not on the slide, but it's also called illusion. So something is there, but you perceive it as something different. Like if there is a rope there and you think it's a snake, or if there's a smell coming and you think, oh, something's burning, but it's like a coffee. So that's an illusion, and that can be a rare symptom of Parkinson's as well. Delusions. Delusions is like a fixed belief which is not true, also like an altered thinking. Most commonly in Parkinson's disease, the delusion can be towards a spouse, like a spouse is cheating, or it can be the paranoid delusion, which means like people are out there to get me, or people are against me. So more on the theme of like fear, suspiciousness, and concerns about safety, or like the FBI is after me or something like that. So these are the most common type of psychotic symptoms that we see. It's good to have an idea what we are talking about, so I'll use these words more. So what is Parkinson's disease psychosis? So as with the depression, it's very common. It can affect about half of all the people with advanced Parkinson's disease, so about 40 to 50% of people. And as Dr. Siddiqui mentioned, it's more common in the advanced stages of the disease. The most common presentation are visual hallucinations. So that's a main difference between people who have psychosis who do not have Parkinson's disease and people who have psychosis with Parkinson's disease. So visual hallucinations are not as common with other psychotic diseases like schizophrenia, for example. What kind of visual hallucinations? So Parkinson's disease psychosis presents with patients seeing people and animals in the room when in reality there is nothing there. Vivid colors, that they would describe, I see like a new color that they tend to describe, but again, hallucination, so it's not really there. Or sometimes it can be frightening hallucinations, so like seeing some kind of a feared object, but again, it's not there. Delusions are also common, but not as common as hallucinations. Most commonly, the hallucinations and delusions are present at the same time. More common in the advanced population, and when people start getting memory problems or dementia. And as I mentioned previously, they're more commonly either towards a spouse or a significant other, like they're not being faithful, or the paranoid type, like people are after me, or just trying to harm me or hurt me. So what causes psychosis? I won't go into details, but in general, brain chemicals and receptors, you've heard dopamine several times, so dopamine and serotonin. It can be a side effect of the medications used to treat the Parkinson's disease itself, or it can be a natural outcome of the disease in advanced stages. So when we talk about side effects of dopamine therapy, So at a very basic level, Parkinson's disease is caused by having less dopamine. So you give dopaminergic medication to kind of restore that balance. But if you overshoot and you have more dopamine in your brain, you can get psychotic symptoms. So that's like a very simplified thing to remember. So less dopamine, you have Parkinson's disease, you give dopamine medicine, but you overshoot, you can have the psychotic symptoms. So the dopaminergic therapy can improve the motor symptoms, but if you get too much of it, you can have the hallucinations and the delusions. Who is at a risk for these psychotic symptoms? So advanced age, people who have the start of this Parkinson's disease later in their life, who have more severe Parkinson's disease and for longer duration, they are at advanced risk for psychosis. People who have cognitive impairments, for example, they have memory problems or thinking problems already. Depression, people who have had depression before are at increased risk for psychosis. Pre-existing visual disorders, which means if someone has problems with seeing even before having Parkinson's disease, they are more likely to perceive things differently. And if someone is taking more medications, someone is using illegal drugs, they are all at more risk of psychosis. So when we talk about treatment, there are medication treatment and then supportive therapy. So before we go into medications, make sure that good sleeping habits or sleep hygiene is encouraged. Keep lights on to decrease misinterpretation of shadows, which means just have a basic minimum lighting on. People are at high risk when there is a change in their normal routine, like if they go to a hotel or just for an overnight visit or just places they are not familiar with. So keeping that to a minimum. Coping strategies. For patients, it's important to recognize that hallucinations do not mean that I'm going crazy. It's a treatable symptom. There's no shame or guilt with it. Most commonly, it's a medication side effect, and definitely doesn't mean that someone is going crazy. You should not react to these visions or sounds, and then caregivers should correct them and not engage in that thought process. So I think Dr. Siddiqui mentioned briefly the psychosis that I'm focusing on. This is at the advanced stages of the disease, but sometimes with a transient infection or a hospitalization, you can have something that we call a delirium. So that is the temporary part, and when we treat the infection like pneumonia or the UTI, so that the transient delirium should get better. Other treatment include if someone is taking medications like Artane or other anticholinergic medications, if they can be stopped, so they can help with the confusion. If someone is taking illegal drugs or any psychoactive medications, even they should be stopped. So again, treatment of psychosis, working closely with our neurology colleagues. If the dopaminergic medications can be adjusted for the motor symptoms, if the doses can be lowered down so that we can have that balance, that would be great. If you can reduce their dose or maybe stop those medications for the dopaminergic medication, that by itself can improve the psychotic symptoms. But if not, then we need to move on to antipsychotic medications. So there is and as a class, if you prescribe any antipsychotic medication, there's an FDA boxed warning. This is not to scare anyone, but it's a class effect that people who have dementia and elderly people and taken antipsychotic medications are at an increased risk of death for other illnesses like heart problems or some infection. But overall, antipsychotic medications are very effective. So these are the three most commonly used antipsychotic medications: Nuplazid or pimavanserin, that is the newest one. It is approved by the FDA for Parkinson's disease psychosis. It is the only FDA-approved medication. But because it's a newer medicine, it's very expensive. Sometimes we have problems getting this through the insurance, but it's very effective as well. Quetiapine or Seroquel is more commonly prescribed It's been in the market for at least 10 to 15 years now. It's very effective as well. It's not FDA approved, but it's more commonly used. And clozapine or clozaril is you need more frequent monitoring, like a weekly blood draw, so it's less commonly used, but it is very effective as well. And a word about the caregivers. So psychotic symptoms affect the patients and the family and the caregivers as well. So when hallucinations are developing, the caregiver burden and stress becomes more. Some psychotic behaviors can be targeted at caregivers. So the paranoid delusions that we talk about, it can be targeted toward a caregiver. That you're not trying to help me, you're just trying to make sure that I don't get better. So that really gets tricky when it's targeted toward a caregiver. So there's a need to protect sleep and give respite for caregivers as well, and that can be done by like hiring overnight supervision or a day of staff for the caregivers. That's all I have. Thank you.